Hi, my name is Nimer, and today I will talk about the initiation of peripheral venous access. In short, how to insert an IV. Now, what is the IV cannula used for? An IV cannula is a technique in which a cannula is placed inside a vein to provide venous access. Venous access allows sampling of blood as well as administration of fluids, medication, parenteral nutrition, chemotherapy, and blood products. Now for the equipment, I need MAR, medication administration record, towel. I need non-allergenic tape. I need IV administration set. I need label for infusion set. I need transparent side dressing, electronic infusion device, tourniquet, time tape, cleansing swab, stabilization device, clean gloves, IV pole, IV catheter, short extension tubing, ink cap, alcohol swab or wipes, skin protecting wipe, and pre-filled 2 ml syringe with the sterile normal saline for injection. Now for the assessment, I check for the IV fluid if it's the appropriate one or not by confirming the label and the prescription, and then I review the lab result because that might affect the IV administration. Then I determine a suitable of a particular vein for the IV infusion, and then I determine the site selection. That's after I consider the accessibility and the condition of the vein. If I can insert there or not. If I cannot, I look for another site, another vein. Now for my implementation, I perform hand hygiene. I provide patient privacy. I introduce myself. Hi, my name is Nimer. I will be your nurse on this shift. I use two patient identifiers. I verify for allergy status. I perform environmental safety check. I ensure proper body mechanism. I gather all supplies and I provide patient education. Hi sir, ma'am. Today I will demonstrate or insert the IV catheter. Now this is for us to be able to insert or administer fluids, medication, or any nutrition that is needed for you to get well. Now I compare the container label by checking the expiration date and the patient identification band. Now after checking, I start labeling the patient name, solution type, and the date and time. After that, I maintain an aseptic technique when opening the sterile package and the IV solution. After that, I close the roller clamp on the IV administration set. I invert the IV solution container and remove the cap on the entry site, taking care not to touch the exposed entry site. I remove the cap from the spike on the administration site. Then using twisting and pushing motion, I insert the administration set spike into the entry side of the IV container. Then I hang the IV container on the IV pole. Now I open the IV tubing clamp and allow the fluid to move through the tubing. The fluid will flow until the air bubble all disappear. After that, I close the clamp. And then I maintain sterility. After the fluid has filled the tubing, I recap the end of the tubing. Now I place the patient on a low Fowler position and then select and palpitate for an appropriate vein. I put on the gloves. I apply the tourniquet 3 to 4 inches above the vein puncture site that I chose. Direct the end of the tourniquet away from the injury site. That's important. And then I make sure the radial pulse is still present. Then I instruct the patient to hold the arm lower than the heart. And I ask the patient to open and close his or her fist. After that, I cleanse the site with an aseptic solution for at least 30 seconds. I use the non-dominant hand placed about 1 or 2 inches below the entry of the site to hold the skin against the vein, but avoid touching the prepared site. Now I ask the patient to remain still while performing the vein puncture. I enter the skin gently holding the catheter by the hub with my dominant hand. I insert the catheter from directly over the vein or from the side of the vein. While following the course of the vein, advance the needle or the catheter into the vein. Now when the blood returns through the lumen of the needle or flashback chamber of the catheter, I advance either device into the vein until the hub is at the vein puncture site. Then I release the tourniquet and quickly remove the protective cap from the extension tubing and attach it to the catheter or the needle. Then I stabilize the catheter or the needle with my non-dominant hand. Now I continue stabilizing the catheter or the needle, and then I open the skin protecting wipe. I apply the skin protecting wipe to the site, making sure to apply at minimum the area to be covered with the dressing. And then I place the sterile transparent dressing or the catheter securing stabilizing device over the puncture site. I loop the tubing near the site of the injury and anchor with the tape and close the site. After that, I regulate the IV as prescribed, and then I label the IV dressing with the date, time, site, and type inside of the catheter or the needle used for infusion. That's all for the IV infusion. Thank you.